Hi guys, welcome back to the channel. So we have started with bisphosphonate induced osteonecrosis of jaw. We'll be continuing that. Okay. Now we have seen why only jaw. सबसे पहला रीज़न देखे थे हम लोग कि the alveolar bone of jaw remodels at the rate 10 times faster than that of long bone. Second, the occlusion and denture wearing area इसलिए ज़्यादा डिपेंडेंट होते हैं osteoclasis mediated bone remodeling पे. थर्ड, जितने तरह के इन्फ्लामेशन होते हैं जैसे पेरियोडोंटाइटिस, एब्सिस, सर्जरी विच नीड फॉर बोन रिमॉडलिंग आर द मोस्ट कॉमन इनिशिएटर ऑफ BIONJ. Now, next common site for osteonecrosis after jaw. What is the next common site? Next common site of osteonecrosis is fracture in the mid shaft of the femur. तो जो फ्यूमर बोन होते हैं हमारे उनके मिड शाफ्ट में जो फ्रैक्चर होता है दैट इज़ द मोस्ट कॉमन साइट फॉर ऑस्टियोनेक्रोसिस. नाउ relates to the greatest bending moment. Focus on this area during walking, running और other activities. Bending area ज़्यादा है मतलब लोड ज़्यादा है. Requires a greater amount of obviously लोड ज़्यादा है तो it will require a greater amount of osteoclast mediated bone remodeling. So next common site for osteonecrosis is mid shaft of the femur. Okay. Alendronate drug इंड्यूस होते हैं ये एंड जो ये फ्रैक्चर होता है उसको बोलते हैं सबट्रोकैंट्रिक फ्रैक्चर. इट इज़ नोन एज सबट्रोकैंट्रिक फ्रैक्चर. ओके. नाउ जॉ एंड मिड शाफ्ट ऑफ द फ्यूमर फ्रैक्चर. ओके. नाउ व्हाट आर द डिफरेंशियल डायग्नोसिस? Coming to differential diagnosis, the first one is osteopetrosis. Last we have seen osteopetrosis, but how will differentiate osteopetrosis? There is a dramatic evidence of sclerosis in other bone. In osteopetrosis, we will see the dramatic evidence of sclerosis in the other bone. Now coming to osteoradionecrosis, how will we differentiate? History of radiotherapy and radiation. Mucormycosis limited to maxilla and insulin dependent diabetes patient. Okay, these all are differential diagnosis for BIONJ. But how will be differentiating this from the osteonecrosis? By this. Okay, mucormycosis is limited to maxilla and insulin dependent diabetes. Now, florid cemento osseous dysplasia, radiographically different and African women predilection. We have seen in florid cemento osseous dysplasia, it is more common or mostly seen in African women. Okay. And sometimes osteomyelitis is also a differential diagnosis for this. Now, diagnostic workup, panoramic radiograph and CT scan. CTX. What is CTX? It's a C-terminal telopeptide. Is a valuable drug only in non-cancer, usually osteoporotic patient who has taken an oral bisphosphonate for less than 7 years. For less than 7 years. But it is useful only or valuable only in non-cancer patient. Okay. Coming to radiographic finding, it will reveal variable areas of osteosclerosis of lamina dura and widening of PDL. General hypermineralization or sclerosis in the alveolar bone. And advanced cases will show small and large sequestra with involucrums and pathologic fractures in later stages. So these are the radiographic findings. Now, coming to staging of BIONJ, what are the stages? It relates to the extent and severity of the disease. Okay, it is firstly the staging was given on the consideration of pain, but pain is never and will never be the criteria for necrosis. So, the criteria for necrosis is the extent and severity of the disease. Stage 1 is the exposed bone in one quadrant. Stage 2 is the exposed bone in 2 quadrant, and stage 3 is exposed bone in 3 or more quadrant, or exposed bone extending into the maxillary sinus, or exposed bone with osteolysis to the inferior border, or exposed bone with a pathologic fracture. So Stage 1 will be involving one quadrant, stage 2 will be involving two quadrant, stage 3 will be involving three or more quadrant and will extend either to maxillary sinus or will show osteolysis of inferior border, or there will be a pathologic fracture. That's all for today. We'll be starting with the treatment and prognosis in the next class. Till then, like, share, subscribe and comment. Bye.